From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
In the past 24 hours or so, medical professionals and patients have been debating the effectiveness and necessities of annual mammograms. Dr. Gupta from Associates in Radiation Oncology is a regular contributor here on Live This Morning, and we've asked her to come back specially to talk about this notion of annual mammograms for women between the ages of 40 and 49, because this Preventive Services Task Force came out with new recommendations that kind of dropped a bomb in this whole thing. It had been an article of faith for a long time. Starting at age 40, women were supposed to start getting annual mammograms. They were supposed to be doing breast self-exams, and that was going to help find cancers in their earliest and most treatable time. Well, now all of a sudden, it's at age 50, and maybe you don't need that annual mammogram, and it all sort of depends on family history. If you're a patient, how can you help but not be confused by all this?
You can't. I mean, when I saw this news come out, that was my first reaction, was wow. After all these years, now we're saying something completely different, and we're expecting the public to understand this. So let's just talk about for a second what these recommendations were based on. So the task force is what they call an independent government-funded group, and they looked at 3 various studies, one in Sweden, one in England, and a database of something, I believe it was 600,000 women, and also did some computer modeling to come up with these recommendations. And what they're trying to make clear is that they're not recommending against screening. So they claim they're recommending against routine screening, meaning you don't just run off every year, and if you're between the ages of 40 and 49, run off and get your mammogram. What you need to do is talk with your physician as to whether you actually need one, which sounds really important, but frankly is unrealistic. And then the second part of the study, the recommendations, was against self-breast exams, because they based this information on 500,000 women in Russia and China showing that self-breast exam didn't save lives.
It's one thing, I suppose, if you are saying, maybe you don't need the annual dose of X-ray radiation if you're in a low-risk group. But why not do breast self-exams? Because even if it is a relatively small number of people who find some problem, potential problem, even if it is a so-called false positive, why would you advocate against doing something that could possibly save a life?
Right. So, as an oncologist, I see the patients who've already been diagnosed. And breast cancer is a common treatment that we do. So if you look at it from our end of the spectrum, it's completely off the charts to tell a woman between the ages of 40 and 49 not to get routine screening, because 25% of breast cancers are in that age group, and the greatest years of life lost from breast cancer are in that age group. So, what their concern is that 39 million mammograms are done, costing $5 billion a year, leading to unnecessary further tests and biopsies and all of that, and may be resulting in treatments for women who don't have diseases that are fatal to begin with. Okay, so, but the problem with the recommendations is it was not a cost-benefit analysis being done. If that was what they were looking at, then that's what they should have come out with. But that's not what they're saying. And now there's this, backpedaling going on about, well, they're not advocating against routine screening, they're not advocating against screening, they're advocating against routine screening.
What are you telling, if a friend came up and said, Anu, what do I do? I'm 42 years old. What's my course?
And that's already happened. Yeah. My emails are from all my friends now wanting to know, now what am I supposed to do? And, from my opinion, basically, is frankly, you do what you would have been doing a year ago. I don't think this should change anything at all. It's not a peer-reviewed kind of study that's being done. American College of Radiology, American Society of Clinical Oncology have not changed their recommendations.
If, in fact, they were trying to, increase the discourse here, they've been very successful with that because it is topic number one, I suspect, in physicians' offices all around the country. Dr. Anu Gupta, thank you so much. As always, we look to you to make some sense out of what is sometimes confusing and almost contradictory advice, and it sure is in this case. Raddocs.com, a great resource for more information there. We're going to step aside for just a bit. At the top of the 11 o'clock hour, we're back with more news. We invite you to join us.